from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
All right, welcome back to Good Morning Arkansas with our sponsor, Baptist Health Oculoplastic Surgeon. I got it right, didn't I?
Close enough.
Oculoplastic Surgeon Michael Chappell here, along with Jeannie Colclazier, to share details on a procedure to fix drooping and sagging eyelids. You keep on amazing over there, don't you?
Yes, sir.
Go ahead with what you do.
I tell my patients that gravity and maturity affect everything. All eyelids start higher and end up a little bit lower over time.
Right.
And what can happen with the upper eyelids is there can be too much excessive skin that starts to hang in front of the vision, or there can be loosening of the eyelid muscles, which can also block the vision. With the lower eyelids, there can be loosening of the tissues that makes the eyelids either roll in or out, and that can actually cause irritation in the eyes or too much watering or tearing.
So this opens the door to a lot of issues beyond just the obvious of their sagging.
Correct. There is a tired look in the eyelids, but more importantly, we can correct the function of the eyelids to allow the eyes to see and function better.
And Jeannie, you were having, we got some pictures here that we're showing on TV right now, but you were having issues that came down to driving.
Yes, absolutely. The further I drove, the harder it was for me to see out from under my lids, and it was really affecting my peripheral vision too, as far as turning, and it was affecting safety.
Did you even think, hey, there could be something that can be done about this?
Not at first, and then through a little bit of education process, I learned that it could be.
And so you had the procedure.
I did.
Imagine it can't be major surgery.
I don't know if it's considered major or
Outpatient?
minor. It is outpatient. I only missed one day of work. The
That's
day
it?
of work that I had surgery, I had it on a Friday, returned to work on Monday.
And now you have a lifetime of driving now without
That's
having that
right.
problem.
That's right.
So it corrected that issue.
Yes.
For you. This procedure, is it a major procedure? How do you do this?
All of these are outpatient surgical procedures. The patient comes and goes the same day from the hospital. They're showing a patient who had ptosis, which is drooping muscles of the upper eyelids, and we go in and tighten up those muscles that gets the eyelashes and the eyelids out of the vision. And here's a patient who had ectropion, which is drooping of the lower eyelid. You can see that red and irritated eye that we fixed by tightening up the eyelid. And there can also...
I've seen that before. Now that's irritation there because it's exposed?
Correct. It's just that pink tissue is the normal tissue on the inside of the eyelid, but if it's exposed to the elements, it becomes really irritated and causes tearing and problems for the patients.
And this is very easy to correct?
It is easy to correct.
For you?
For me. All of these surgeries take less than an hour to do, and the patients come and go. They're a little black and blue and beat up and bruised for a little while after the surgery, but very quickly they return to their normal function. And here's another patient who had an eyelid that rolled in. We call that an entropion, and as you can imagine, those eyelashes rubbing up against the eye can cause a significant amount of irritation. So by correcting that, we can make the patient a lot more comfortable.
Besides, Jeannie, your issue was driving. What are some of the other issues people experience from eyelid drooping and sagging?
Driving can be an issue. People describe when they're trying to read or watch TV in the evenings, their eyelids feel very heavy. There's the tired look that goes along with it as well, but the insurance companies will pay for these procedures if we can show that there's a functional problem with the eyelid, where the vision is blocked or it's causing that eye irritation.
Yeah, because I imagine driving was a challenge for you and a hazard on the road if you're not able to see.
Absolutely. You never knew when something was going to be coming out from the side because it limited the side vision.
Okay.
So when it was fixed, it was amazing that I could see.
And within one day, you're back at work.
That's right.
With full vision.
That's right.
That's fantastic. And like you said, insurance companies do cover this procedure.
Correct. These are, as long as we can show that there's a functional deficit, a functional problem, then insurance plans cover these, including Medicare.
These are just one of the other amazing things that you guys are doing over there at Baptist Health.
Yes, sir.
All
That's
right.
exactly right.
I think we have your contact information. If you're like Jeannie and you didn't know that there was this available to you, and if you have any of these conditions or any other eye condition,
yes, sir.
Oculoplastics.
Yes, sir.
Oculoplastics. There's his information over there on Baptist Health Drive. The phone number is 501-223-2244. I've got to have good vision if I can read that
Absolutely.
from here, can't I? Because I was reading that on a small little TV monitor off in the distance. And 1-888-BAPTIST, 227-8478. 227-8478, the Baptist Health Line. Thank you so much for coming on the show.
Thank you.
Congratulations. I imagine it's a whole new world for you now.
It is. It's wonderful.
Right. Thank you very much for coming on the show.